When you begin to implement new technology in any sort of healthcare environment, you have to understand the impact that's going to have on your providers. And one of the ways you mitigate that impact is obviously by the way you build and deploy the electronic health record. Integral to that deployment is training. At MD Anderson, before we deployed the Epic electronic health record, we set up specialty-specific simulation labs. We found that this was the most valuable training that people had, and the Nuance implementation, EHR implementation group, was critical in providing this experience, creating this experience, and helping us deliver this experience at scale to our organization just before we went live. Nuance EHR Implementation Services helped us with rolling out the whole Dragon 101 and Dragon 201 classes. They're instrumental in putting together the curriculum, doing at-the-elbow support, helping our providers actually understand the technology and work through the voice profiles. And with the 201 classes, begin to use the advanced features on the Power Mic so that all the shortcuts and all the tricks that can make you more effective and more productive, they're able to be able to use that. The Nuance platform is deeply embedded into the Epic platform, so we find a lot of synergy there. We find a lot of utility in the way that they're knitted together, so it's not two separate applications, but really a much more seamless experience.
From a clinical documentation nurse standpoint, I think one of the greatest advantages is the education that's involved with the program. Through this education, the physicians, I think, are better able to document. And because the electronic medical record now is the way the physicians communicate, I think the communication from physician to physician, specialty to specialty, even nurse physician, is improved because of the education that has been provided. That education is something that I have not seen in any other program that I have reviewed.
I can tell you with great certainty that in Southern California alone, we would not have been able to attest successfully for MU2 were it not for Nuance. Several teams of Nuance went in person to the sites to personally explain how things were going to be progressive, innovative, and that we were going to have a wonderful experience. And the reality is that I did get specific feedback from my CIOs and CMIOs from these different sites saying they were very happy about the resources that were provided from Nuance. And one thing that I'm very appreciative is that it hasn't stopped. I'm very thrilled to continue what I call a partnership with Nuance.